those pictures just to be answered. The education is the wash for school children, sanitation and hygiene for school children emergency, the guidebook for teachers that comes with the companion flashcards. And this is one of the tools that we are going to introduce during the session. We're not going to go in deep on the tools, but I understand that they are also going to be available in the web that you use for the course. So get started. A little of an eye on what we are going to see during the presentation today. Basically, an introduction why washing school in emergencies, trying to address the importance or try to emphasize the importance of preparedness as a critical component to have a better response. We are trying to cover a little bit of what is school in emergencies in terms of response that it's needed between the one and the software components. We're going to walk through a little of the materials and tools that are available at the level, so you can have access to them. Basically, the idea is to give you additional elements for you to develop your own tools at the country level and get a little more prepared for emergencies, specifically in terms of washing schools. So, washing in school in emergencies, we say. First of all, let me say that what we already know, I mean, you are now at the end of the course, so I'm pretty sure that you have already seen that. But the offline or the official UNICEF position, not only from WASH, but from education and for all the sections, is that a school cannot be a school without having WASH facilities. And we have heard this a number of times, I'm sure. And this includes also emergency situations. So schools or interventions in terms of education, temporary learning spaces, school in emergencies should and must include a WASH component. And that's basically the standpoint from UNICEF perspective at least, and also from the part that work with us in the education and WASH in the schools. In the school in emergencies, again, schools and temporary learning spaces must be safe and healthy spaces. So children have the opportunity to play, learn, and have the ability to return to a little bit of a normalcy. To be safe and to be healthy, those spaces need to have appropriate and safe WASH services. Schools and temporary learning spaces are also an opportunity to provide children with survival skills that they will need to adapt to the sometimes hostile environment that emergency poses on them. And for instance, having knowledge on safe hygiene practices, on where to get safe water, on how to use sanitation facilities, this knowledge is going to give them opportunity to protect themselves in the other environment in which they might be living due to the emergency, due to the crisis. Also, we know that, and this is not a recommended practice, the reality is that schools are often used as a shelter. And when we are hosted in the schools, basically, we also need to provide the water, sanitation, and hygiene requirements of the population living there. And I think one of the most important ones is that what school is a children's right, is a mandate, and is also our commitment. This can be used to have us accountable for providing services in schools and temporary learning spaces, but this can be also used for WASH as a tool, as an endpoint, to have those services provided and to promote integration between the water, sanitation, and hygiene sector and the education sector, for instance, the child protection section, in child friendly spaces, and so on. You know, our commitments for children in humanitarian action. Most of you have already seen this booklet, the core commitment for children in humanitarian action. which really provide with the overarching framework of UNICEF strategies and activities in humanitarian action. So ago, before the 2010, it used to be only in emergencies, but now it's a more holistic approach. I mean, the humanitarian action approach. We give us the opportunity to work not only in terms of emergency, but also in terms of disaster reduction, in terms of conflict. Specifically for WASH, it defines 5 commitments for which the WASH sector is accountable. And commitments are and I'm sure you are really aware of that, it's just to review this. The first one in terms of leadership and sectoral coordination for the WASH sector, which includes cluster and activated, but it's not only limited to the cluster, it's actually sectoral coordination as a whole for emergencies. It includes supply water, safety water, sanitation facilities, clean washing, hand washing, bathing facilities, and consideration for menstrual hygiene management as well. Hygiene promotion, dissemination of hygiene information, hygiene education, and the 5th one is the what we used to call the WASH as a service sector, basically providing the water, sanitation, and hygiene services in, for instance, temporary learning spaces, temporary schools, child-friendly spaces, temporary feeding centers, and all other places in which children require a safe and healthy environment, and WASH is obviously a strong component of that. But WASH in schools in emergencies, we saw that it's part of our commitment. But the 4 CCCs are a clear focus and a priority. But the 5th one, WASH as a service sector, as I just called it, it's of WASH and education, WASH and child protection, WASH and other sectors that need to get together. For WASH schools specifically, the education sector should take the lead. However, each emergency is unique. We have cases in which WASH in schools have been integrated within the education response. We have cases in which WASH in schools are a standalone component of the WASH program. So the main idea that we want to stress here is that WASH and education should always work together. It's not only a WASH commitment, it's not only an education commitment, it's a commitment from both sections. But in reality, we tend to work in silos. And used to deliver our response in terms of WASH, in terms of education, in terms of child protection, the other sectors. But we need to, in the case, for instance, of WASH in the schools, it's actually a UNICEF commitment. It doesn't matter where does it sit. This is a UNICEF commitment, it's an institutional commitment, not a sectoral one. So, regardless on where the resources fit, we're working together with the respective sectors in order to achieve our results. So WASH should be proactive and reach the other sectors and getting things done, let's say. This is blaming anyone. This is not about pointing fingers on somebody else in terms of saying you are not doing your job, we are not doing our job. But we really need to improve the relationship between both sectors and the harmonization of what do we do in terms of emergency response. Just to give you a little bit of an example that comes from the Pakistan 2010 floods response. After the week 13, when the sectors were really working and really implementing the program, it was found that between child protection, nutrition, and education, what was expected to be provided in more than 5,500 sites. Child-friendly spaces, temporary feeding centers, temporary spaces, and schools. And those, the temporary learning spaces and temporary schools, more than 5,000 sites. What did it in terms of resources, let's say, or in terms of capacity? We needed to have an additional team for WASH in schools only that was not considered in the WASH budget or either in the other sections budget. It's like gap of more than $7 million. So it's just to show that if we don't have this interaction between both sections done from the beginning, we're going to suffer of gaps in our emergency response. So, Washington in emergency. We cannot stress enough the importance of having preparedness as the best way to improve our capacity and our performance. The moment to improve our response before the emergency happens. So invest in preparedness, invest time, invest resources, invest capacity, and start getting things done even before you will need it, and you will realize how important it is. Though there is no specific Washington school in emergencies standards, there are a number of tools, of guides available at the global level that can and should be consulted when conducting an emergency response. So one of them is the INEE, Minimum Standard for Education in Emergencies, which basically includes and comprises the provision of water, sanitation, and hygiene services in schools. We have the WHO and UNICEF standards for Washington schools in local settings that give us a better indication on what would be required for having those services provided. And we also have the minimum standard for humanitarian response, the Sphere 1, which includes specific considerations for schools within the WASH component. Also, in terms of, I just saw a question in the chat box saying, is there a WASH minimum standard? We have, as per the vector, we have the WASH minimum standards that are included in the Sphere, and it has specific considerations for schools. There are not specific WASH in school in the emergency standard, as I was mentioning before, but we can use those three guidance, these guidance, in order to develop national or local standards for responding to washing schools during emergencies. Yes, the book that I'm talking about in terms of washing school standards is the one in the middle, the yellow one. And that one is, in terms of reduction, there are a number of things that can be done in terms of reducing the risk of schools and the water facilities included in there to be less likely damaged by an emergency or by a disaster, let's say. And this should be part of the recovery and reconstruction of the schools, but can also be incorporated in the development program. So as much as we can incorporate those risk reduction measures, we are going to have less impact of the disasters of the water and sanitation and the school settings. So, in responding, what should be a response watching schools in emergencies? First of all, the assessment. We know that we need to have a timely assessment from the WASH sector and education sector, and the education sector will go and do the assessment of what's happening at the school level. So be sure that get WinS schools in that particular assessment. So otherwise, we are not going to have an idea of what are the needs at the ground level. And we need to start including this from the beginning. We need to have our assessment tools ready even before the emergency happens. I don't know how many of your colleagues at the country office they have already developed a checklist in order to know what the situation is for washing schools in emergencies. Or if you are an assessment tool are really agreed and ready to go in the case you need it. And please remember that, and that's one of the messages that we want to pass. The interventions should be prioritized based on health and hygiene, as opposed to go with the full package, because further improvements and achievements of high levels of services should follow as response progresses. overdo from day one, starting the needs as they appear, but don't miss the global picture. Let's say. So it's preparedness. We're basically going to show you here what the rationale might be applicable in terms of preparing for emergencies. So basically, an analysis and risk profiling of the specific situation at the country level by asking ourselves what can go wrong, what the impact over the water supply and sanitation systems, over the schools, given an emergency or given a specific event. What happened with availability of soap, methods of hygiene management supply, for water treatment? What is the staff? What can happen if a disaster strikes in a given context, not only in terms of fishes, but also in terms of operation and maintenance for water and sanitation services? What access? Can we foresee what is going to happen with the access if something happens in a given country or in a given area in our country? If we have a shelter, there is going to be increased demand. There's going to be problems in terms of drainage, solid waste management. There are going to be a number of issues that we need to consider before in order to be prepared for responding. And the likelihood of all those considerations to happen, that all those risks to happen, we need to think about it in order to be prepared. But once we identified what the impact or what can be the need, that what can be done in advance? What can we do now, knowing that this is going to happen? So, should we go for reinforcement and protection of schools? Should we identify technical solutions and methodologies and methods that can be defined in advance? With position supply, of course, if we identify this as a bottleneck that might rise in an emergency, we find the two emergency response, as I mentioned before, assessment tools, checklists for what is going on, technical designs, bills of quantities. We can start developing those from now, and we can have an agreement on what our response will be, what hygiene promotion materials, what training materials we're going to use. If we do this the emergency, we will see that our response will be a lot smoother, and we are not going to lose time when it is the most critical. And we have seen, and also training of officials on the staff, and we have seen again and again and again that not having those things prepared is quite. We are basically starting from scratch in every single emergency because we haven't invested that much in preparedness. And the ability to start doing this in emergencies, we have capacity, the resources, we have the focus for start doing that. So there's some issues that we need to start thinking from the preparedness stages in order to be able to respond. So some examples on preparedness, and those examples are being collected in one of the tools, the Wash in School in Emergency Facilities, a compendium that has been developed in the last year by the Wash in the Schools here. And I'm showing you three elements that were collected in the compendium, basically in terms of division of prepackaged solutions, in terms of a provided structure that was available for this deployment, in terms of identification of technologies. So please give us a couple of minutes for you to share us on what can be done, what have you done at the country level for improving preparedness in terms of washing the school. We have from Laos the Blue Box developed to support hygiene education in the schools, including games, work cards, posters, integrated into lessons in classes, and extracurricular activities. Great, congratulations. That's exactly what we think we'll be doing a little bit more and more often. So congratulations on that. Another message: during emergencies, temporary school settings are zone of peace protection where messages of health and hygiene can easily be given. Totally agree. Schools should be safe, healthy environments, and for achieving that is a important component. In Afghanistan, we are trying to introduce the water quality to schools through support of the Ministry of Education. Sure, monitoring is a key part, not only in terms of the response, but actually in terms of the day-to-day activities. In Nepal, we are using bison filters, so there's the idea of we position the supplies that we're going to need to include that. We find guidance and materials that will be used in emergencies. So that's the next step if this has not been done already. So thank you very much for sharing these messages, and please feel free to keep sharing either here in the chat box or later on in the discussion that happens in the website. Move. So as consideration in terms of UNICEF and preparedness, we have different preparedness and contingency plans or contingency activities. So get watching the school in emergencies as parts of those preparedness activities. Either this is a sectoral preparedness or contingency. This is an office, a UNICEF office preparedness exercise. If this is the WASH section preparedness, get in the schools. So I'm putting here 3 examples: the interagency contingency plan that some countries develop, the EPRP, Emergency Preparedness and Response Plan. Some country offices have those. The early action system, which is the new approach in terms of UNICEF for prepared for emergencies. Get in the schools in there and invest on building your capacity to respond. Don't just put this to tick the box. If you think that you need to improve training of teachers in promotion for watching the schools in emergencies, put this as well in your annual work plan. Otherwise, this is not going to happen. Course education, and probably also with child protection, because hygiene education should be done either in schools, temporary spaces, but also in child spaces. Define responsibilities. What is going to happen if an emergency comes, let's say tomorrow? Identify your partners. Who can you work with for watching the schools in emergencies when this is required? Build capacity or build the capacity to respond together in emergencies into the existing partnerships, into the PCA that you have. If you have a PCA for watching the schools in emergencies, are including an emergency component into that? Let's say an emergency happens tomorrow. Can you deviate the watching the school program to cover the immediate needs that happen because of the emergency? Include inclusions. If they have PAs, if they have partners, if they have the capacity to do watching the schools as well, are they included this in the plan that they have for emergencies? Ismail talked about challenges in the convergence in convergence of sectors. It's totally true, Ismail. We're very aware of that, and from headquarters and from regional office, we are increasingly advocating for having integration between different programs, and we are well aware that this is something that has to do with management, define the priorities with management, pushing ourselves for integration as well. So yeah, we are aware of that, and these results are constrained in terms of outside UNICEF integration as well, because ministries work as we do in silos. And the thing about preparedness in terms of UNICEF, identify the resources that you will require if something happens more again, what the resources you would need, what human resources you would need, supplies and logistics, what guidelines, what designs, what tools you need for responding to emergencies. Have you developed your assessment checklist? You developed your designs for watching schools in emergencies? Have you developed quantity, your high promotion in emergency material? If not, let's start thinking about that. In terms of emergencies, I just want to put in considerations here. This is not the recipe, but this is probably something that you may want to take on board in terms of defining your scope of the emergency in terms of watching the schools. The hygiene promotion and education should be done in the schools and temporary learning spaces and in child-friendly spaces as well. It includes children, but also teachers and caregivers receiving key information on hygiene. This information, and this should be, in terms of school activities, should be appropriate in terms of color, but also in terms of age. We cannot use the same materials and the same methods that we use for the population or for the population. You cannot use the same school children. They have different ways to learn. They have different ways to absorb the message. So this is the extract from the teacher's guidebook that I mentioned before. So get your watching the schools in emergency activities as interactive as possible and promote children participation. I'm just putting some pictures there to show you some activities we have collected so far. And in those with provision of hand washing facilities, not only reliable water points for hand washing, but also ability of soap, ability of material for hand washing. We have two complicated infrastructure for doing hand washing with soap. Those are just a couple of examples that we have seen in the field. In terms of, let's say, hand infrastructure, provision latrines in schools or ways for safe and disposal, and here inclusion of consideration for menstrual hygiene management. One of the tools, which is the companion washing in school in emergency facility, we have included some things have been done at the country level in terms of menstrual hygiene management. Some incinerators, let's say, some menstrual hygiene management facility, but what we think is the starting point is: are we consulting what their needs are, or are we just assuming that they need what we are providing? So let's take a minute and think: where are we getting this information from? I mean, if we're really addressing the hygiene management needs of girls and, by extension, of women in the community that we are trying to serve. In terms of the sufficient quantity and quality of water for children in schools. I'm putting in the screen just an indicator of what is here, gives us a recommendation, and you can also define this at the country level as well. Yeah, exactly. Great. You can consider the adaptation and the adoption of all the tools that we have available at the level and develop your own. Get together with partners and develop what is to be the more relevant for your case. And in terms of washing school in emergencies interventions, consider operation and maintenance requirement for washing schools. Do the same that you do for wash interventions. If you have a specific budget for operation and maintenance in communities, why don't you have the same type of intervention at the school level? And include wash schools as an explicit component on monitoring of the emergency response, either in wash component or the education component, but get things done there. What is asking about operationalization of the incinerator? I don't want to go on details from our. I'm gonna share with you what is the the compendium of washing school in emergency facilities. Unfortunately, we do not have the time to go in deep on all the technical options, but it's available on the website that you are using. From about having child, gender, and disabled friendly toilets in the washing school in emergency. Mentioned before, this is not a recommended practice, but when this happens, we need to be prepared for covering those needs. Schools are used as shelter, are usually used as a shelter, and the temporary needs of the people there need to be considered and need to be covered. So some challenges for the WISE sector to respond on those scenarios. We need to prepare with it, but we need to be careful how do we provide in order not to damage the structure and the facilities that actually belong to the school. And how are we going to do this without overloading the existing structure is something that we sometimes cannot do. But we need to consider reducing the risk of lifting the infrastructure of the school. Let's say. We need to all the interns that we do in the school are at the end of the operation recommissioned. We have seen examples of latrines being built in the schools because people were there and they were abandoned and creating a risk for the children that came to the school after the emergency happens and found that this is not a healthy place anymore. Some of this damage needs to be repaired and, if possible, improved, and all interventions need to be handed over to the appropriate authorities so they can keep maintaining and operating in the future. And of course, one of the things is that as people are in the shelters, the school activities will be disrupted, so that's why we are also covering the needs on temporary basis. So, in terms of rehabilitation, reconstruction, know that when damage in the school facilities have been extensive, they are kind of the temporary solution that we put there are likely to be semi-permanent or having an extended duration, let's say. So how are we going to cover the wash needs without implementing quite complicated solutions, and how washing in schools incorporate the maintenance requirements that these interventions will have in the medium term. All these emergencies give us opportunities. So we have heard before building back better, but what does it mean? As I said, it's an opportunity. New facilities should consider what they are in the specific location in which we are operating. If there's a solution for reducing risk, why don't we use it also for our development intervention? Yeah, I know that budget is a constraint. That's why I mentioned that one opportunity is to start this with our emergency interventions, because we know that emergency attracts resources, and show it can be done, and then advocate include this a part of our development activities. Yeah, I know how we need to be a little better in terms of advocating for including those in the right ways. Also, opportunity is opportunity arises in terms of reinforcing, promoting improvement in terms of national designs and standards, and that's exactly addressing the point that our colleagues mentioned before. Can we use the emergency as an excuse to review system guidance that we have for schools, that we have for schools specifically, so they can, so those considerations for reducing risk can be incorporated in national policies, national regulations. So, and I think that's a valid opportunity that we can take advantage of. So they are many, are they? So you the late statistics, let's say, that we had from 2012 in terms of watching the schools emergencies, 46 country offices reported watching the schools in emergency interventions. 57 reporting programmatic humanitarian watch interventions. So what happened with the other 21 countries? Is there up? Did the other country offices not do anything about watching emergencies? So this is not we report what we are doing. So let's but also document a little bit better. We are very aware that we are not that good at documenting, and basically the advantage of this, because in most emergencies we have to start from scratch. So please share experience a little bit and document what you are doing, so it can be used by others in emergencies in the neighboring country, in the region. HQ, we can help to disseminate and provide reference points for accessing those experiences, those learning. Very quickly, just a run through the available material. For hard actions, we have the Washington School teams have recently developed a compendium of Washington School facilities, which is really a collection of cases of what country offices and partners have done providing Washington schools emergencies in previous years. For the software, we have the Washington School, the Watch for School Children in Emergency Teacher site, and the compendium for Ashka that we have mentioned a couple of times. We have other tools or other available. The Washington Schools monitoring package that can be used as a first step for defining your assessment, your assessment for emergency. The Washington Schools standard that you can use as a reference for your response. Ending of temporary learning spaces. This has been developed by education. Why can we not do something specific for Washington Schools? Use those tools to adapt your own, to create your own at the country level. Try to as much as possible harmonize the tool that we're using in emergencies with what we're doing in government. The minimum standard also includes considerations for hardware interventions. Yes, but we think that we need to go a little bit better, not knowing that we need one toilet per 50 or per children. What the toilet looks like, and invest on on finding the solution, the technical drawing, develop fund. Can we do that in advance? If so, we probably start doing it. So, some questions that we can please have a couple of minutes to use the chat box. Do you think a companion of facilities is required? So, do you have it? You can have it. That includes technical drawings, bills of quantities, those kind of stuff. Do you think a guide for teachers on hygiene promotion in the schools during emergencies is necessary? If so, do you develop any? Do you include the training of teachers as part of your preparedness plan? So you get support from when it is required in emergency. And are clear who is responsible for what in the schools, in the government, what are your counterparts? Do you know them? Are you in contact with them? You may start looking for who is going to be the one that you will be talking to in emergency response, so you can create a partnership, you can create confidence, you can create working relationships from now. So please, let's take a couple of minutes just to share something that happens in your country, in terms of what are you doing for better response for Washington School in emergency. review on the sphere guidance was done in 2010, and the last version was the one released in 2011. Great. Bhutan has a school health and safety guideline which encompasses all issues. Are those adaptable for emergencies? Probably that's a question that we can ask. Do you have materials ready for emergencies? Because I understand that this school health and safety guide is something that is for regular programs. How teachers' guidance and hygiene promotion be different from non-emergency situations? Probably not. Probably we're using the same materials, but probably we need to adapt. For instance, the hygiene promotion sessions include more interactive activities to be included as part of the emergencies curriculum for education, let's say, or how we emphasize the issues about risk or that will be part of the deterioration of the situation because of the emergency. For instance, if there is a risk of cholera in the country, are we putting a specific message for cholera? That's probably an idea. Laos, SMB silently watching the school with integration of emergency issues and hygiene promotions activities are organized by communities and people. Good. School management is responsible to wash at school. Great. Have you built a relationship with them? Have you start working with them from now so they can be better prepared for responding as well? Yeah, sometimes if it's there, it's not circulated. So let's start getting things communicated. The last two slides to close the session and to go for some questions, or for more questions, let's say. So, conclusions that arise after the development of the tools. Again, documentation of experiences is weak. The high rotation of staff members in emergencies is probably one factor. Definitely, we are still starting from scratch in most of emergencies. Emergency preparedness is key. Technical design, develop bill of quantities, and plan for gradual improvement. Don't try to do everything from day one. Keep the big picture with you and start doing it step by step. And you have the tools that's been developed available in the Blackboard site. I guess this message has been passed before, but just to re-emphasize it, do not overdo. Do not go for a 20,000 school train if you don't have the resources. Don't spend all the resources in preschool if you can do 20 with probably a little bit less of level of service, but reaching more kids and having more results, let's say. Some conclusions that we can mention at this stage. Preparedness, we can emphasize it enough. Your assessment tools are great and ready. After design to build quantities ready to be used. Have people trained on hygiene promotions. Develop your tools. Test them. Be sure that they are the ones that will work effectively. Use the precious time that we have in emergency to start validating, because I mean, you need to start doing things from day one. Basically. Again, share your experience. Document. It's important for you to learn, but also for us to learn from your experience. And the last message, better to do a little at a time and in a sustained way rather than do everything at once, but keep the big picture. Thank you very much. That's all from my side. We are learning about watching schools in emergencies. It's an increasing area in which we see interest from country offices, and the demands are increasing as well. So please let us know how can we improve. Just a final message from my side. Again, Washington Schools is a growing area, at least in emergencies. The number of countries that are requesting staff for support in their emergency response is also increasing. So you have the skills, you have the experience, if you are willing to deploy the part of emergency response. Come to your HR locally, your human resources locally, to know if your region has an emergency response team. But please update your profile in the recruitment system. All of us have a profile in the recruitment system. This is the only way that, at least from here, from headquarters, we have to know that valuable human resources at the country level that are willing to deploy and have the skills for responding to cases for school and emergencies, but in general for emergencies. So please update your profile on your recruitment, your profile, because that's the way that you will, let's say, in the system. So thank you very much, Murad. I guess we open the mic for questions.
Thank you much, Jesus, for presenting and walking us through. As you said, washing schools in emergencies. I think the core corporate commitments also include washing institutions and washing schools since 2 years back. So if we go back 5 years in the organization, it was not a clear responsibility or a commitment saying that we have to reach out to all schools, all health institutions, all temporary learning spaces with WASH, and it was a hidden kind of thing. So it's made explicit 2 years back. So we are learning, we are trying to do better, but a lot depends on the preparedness. If we are better prepared, if we can imagine what temporary learning space will look like, then we can really respond better. So imagination is key, and at youth headquarters, like every 6 months, they do a 5 drill. We go out, all the building is emptied, so it's really important to do those, stopping and taking a moment and seeing whether our emergency preparedness plans are good for schools response. Great if you can connect with Jesus after the session via email or at the Blackboard site, and you can contribute to global learning on washing schools in emergencies. Again, thanks, Jesus, for presenting. If there's any question, you can use the chat box to continue, and also reaching to our 1 hour limit. But I would like to see if there's anyone who would like to present their progress on their case study. If you can email me your PowerPoint presentations, I can upload and you can talk through on your case study. I'm not sure. Afghanistan was saying they may be able to present, and we had some email exchanges, but I didn't receive the PowerPoint. And if you want, just send me an email and I can upload your presentation. Or if you just want to speak, you can open your mic, raise your hand, and we can ask you to talk through on your presentation. Maybe it's 5 minutes. Since until now, I got, I think, 6 case studies with Peter van Manen. We have provided the feedback on those case studies that we received, and it seems we are going in the right track, but it's really important to put our energy. And one key comment that I have provided was reading the past case studies. It really gives us idea to a little bit focus and not take a huge, big research work or huge responsibility when writing a case study. It's much more condensed and focused, and the past case studies gives you ideas. This presentation will be uploaded at the Blackboard site, and also the relevant links to publications. Great if you can download and take your time to read, and also comment at the website.
Thanks, Murad. I see one post saying expecting a little bit more related to safety in the water and sanitation. Uh, there are tools available in terms of water safety, if that's what you mean. If you're talking about making water and sanitation services safe in schools or at community base, we have been working with the child protection section last year to develop guidance on protection and water and sanitation intervention. So that's probably something that we can include in the board. If you have more questions, please raise your hand or type in the chat box. Thank you.
Well, thank you very much, Jesus, for the presentation. We can follow the discussions at the Blackboard site, and you can access to the questions and the posts that colleagues will make at the Blackboard site. I don't see anyone sharing their PowerPoint presentation on their bottleneck analysis. Maybe a very quick update on what will be next. First thing is next Monday, the course exam will be posted at the Blackboard site. You will have access to a description on what the exam looks like. It will be most probably multiple choice selection questions, about 30 questions, and it's an open book exam. You need to sit individually and then walk through each question. You can use your computer and paper and your notes, and I mean, you will find more information on the exam at the Blackboard site, and we will be emailing to every participant. It will be starting from next Monday, 18th of February. You have till the end of the month to complete your case studies, but great if you can share your drafts by the end of this week. If you want to have some feedback from me, Peter van Manen, or Matt Freeman, I hope you can use the opportunity to get some feedback as the date is getting closer. So it's really important to get a draft to Peter van Manen, myself, and Matt. So the exam will be, the information on exam will be available on 18th of February at the Blackboard site. You have a week to complete, and you will have more information on how to take the exam. So it's a multiple choice. On 18th, you can see on the Blackboard site, you have a week to complete. So by 25th of February, you need to set a date and time that you can take the exam. And Abdul Salam, if you email me your PowerPoint slide, I can upload. I can make you presenter, but it may take a while to upload your presentation. You can email me, and I can upload it, and you can talk on your presentation if you like. Is there anyone who has a question to Jesus since he's online? And if you have any other question or any other topic that you want to add, please do. And congratulations, it's really a long journey, a long commitment to reaching to this stage. This was the last WebEx module on our journey. It was months, and two things left: completing the case study and taking the exam. And I'm sure we will do good. Nirupama, you have your hand raised. You can speak to your mic. Not yet received the presentation from Abdul Salam, so I'm waiting. If it comes, then you can talk to it.
Murad, I see the question in the chat box, basically the do's and don'ts during emergencies in the water and sanitation front. I think that's the question. Yeah, I mean we can improve the presentation by including this. It's a little bit difficult in terms of time to try to cover everything in 45 minutes, so we decided to go with this presentation, and actually for do's and don'ts and recommendations for Washington emergencies, we have a whole training, one-week training that we run with regional officers, and the next one is going to be on Thailand in 2 weeks, actually organized by APRO. And yeah, we would love to include a bit more always in the presentation, but unfortunately we have limited time. But there is information available, and we can send this to you through your Blackboard website. But again, we have some recommendations from this side, but the best way to realize what to do and what not to do is by documenting the cases. So again, a call for investing a little more on the cases written and available.
We're waiting for another couple of minutes to see whether I can see the presentation. I haven't received it yet, and earlier also we sent the email to participants to share if they have any presentation to walk us through their case studies. Again, just to very briefly summarize, 18th of February, you will have information on the Blackboard site on the exam. You have a week to take the exam, and you can define the date and take the exam. It's an open book exam, and it's a multiple choice one, so it will be great if you have all the presentations and notes and other stuff on your computer or next to you, so you can find the answers. The second thing is, by the end of the month we need to finalize the bottleneck analysis. If you want feedback, then send us your drafts to Matt Freeman, Shadi, myself, and Peter van Manen, so that we can give you feedback if you need. And it's always good to read the past case studies to have more idea on what has been done, so you can build on the learnings. They're not great examples, but it gives ideas on where we are with writing case studies, kind of thing. Again, let me check my email. I don't see yet any presentations sent to me, and I don't want to drag everyone to wait for that. So apologies for not having any presentation on case studies. I just want to say thank you again for reaching to this completing WebEx component of the course. 2 things left: the exam and the bottleneck analysis. Great if you can share your draft, use the Blackboard site to upload your completed ones, and get in touch with Peter van Manen, myself, or Matt Freeman on your bottleneck analysis case studies. And for questions related to washing schools in emergencies, Jesus will be online at the Blackboard site, so you can see and you can post your comments and questions if you have any. And you can also directly write to Jesus Trellis to show your interest to support any emergency activities. Since I just received Abdul Salam's email, so for those who want to stay and who has time to stay, you are welcome to stay. I'm trying to download the email so that I can upload the presentation and we can look through what the team has done. I think you can see the Afghanistan one. Who in Afghanistan wants to step in and walk us through? It's, I think, few slides, and you can say next, and I can click the next button.
Yeah.
Yeah, I can hear you. Please, whenever you say next, I can move the slide.
Okay. Thank you very much. Thank you to all our colleagues, and sorry for delay. Just we thought that you have already received the presentation, but now it is good news you have received. And in a very brief, I would like to present what we started, how we started to develop the case study of Afghanistan in Washington School. And if we go to the next slide, we can just briefly say why we selected Balkh province, as Balkh province is the center of 9 provinces in the north, we call north region of Afghanistan. And UNICEF started actually its Washington School activities from the north. And the other reason why we selected the province Balkh to get the sample or collect the data was that we actually during the period when we were following the course, we had some kind of activities, specific activities in this province. In this, because of these all, we selected Balkh to be a sample. And the methodology we used, it was very simple. However, in the beginning, we developed a case study for all of Afghanistan to have a bigger picture of WASH in school situation in all Afghanistan, which was not actually accepted in the beginning. And then based on the guidance we received through our mentors, through our colleagues, and the comments and suggestions, we revised our case study, and then we selected 10 schools in a very simple ways to collect the information based on the indicators we developed for WASH in school. And then through those indicators, we used prepare the checklist, and through that checklist we could collect information. And it was through group discussion and direct observation of what the students are doing in the schools, and also checking the documents, review the documents, and conduct interview with the teachers and the students especially. It was participatory with the teachers and in the schools, and the headmaster of the schools, with other school staff, and also one of our colleagues, WASH colleagues in each school. At least we selected 10 students to be interviewed in each school, or to be observed, or to attend the group discussion. The next slide. Yeah, as I told, we selected 10 schools in the province, and the methodology was direct observation and group discussion, and also the interview. The tools used, I already said, that the checklist based on the indicators we developed, we collected the information. And for setting the schools of also, we try to have diverse in this data collection. Means have urban areas, schools located in the urban areas, and also semi-urban areas surrounding the city capital, or in the villages. And the other point we considered was different type of schools, not only boys or not only girls, but include only boys schools, only girls schools, and also only mixed schools to see the diversity. And the schools with high population and also with the low population, mean with the schools which had only, for example, 400 or 300 students, and also the schools with more than 5,000 students. So based on these criteria, we selected the schools, and we collected the data. And the other slide is Yeah, here you see the information about the result of this data received from the schools. Based on these 4 categories, we the set indicators. For example, for the first one, we had 85% in some schools. We observed that 100% in some of, especially in the urban areas. For example, there were 100% the students were observing and washing their hands after using the toilet, but in some others, 80% of them were using they were washing their hands, and 20% didn't. And the other indicator, which is regarding the budget for maintenance and of the wash facilities, we found that there was unfortunately no specific budget allocated through the government. Here, financial budgeting or these things. And the other so it was 0. The other indicator, provision of schools with wash facilities, it doesn't mean it is 100%, but it doesn't mean that the 100% all 10 schools have proper set of the wash package, wash facilities. It means that some of them were missing. For example, there was no specific hand washing facility in some of these schools. But again, they had some other, they were using other options, like there was, for example, a water tank was taps for drinking water. They were at the same time using the hand washing facility. So, however, it was not close near to the latrines. So it was not based on the standard, but at least there was. So we accounted like 100% this. With this, some mistakes what was there or incomplete seat. Another indicator with trained caretaker of wash facilities. We didn't found any school with trained caretaker to take care of wash facilities if there is minor repairing or these things are needed to provide support in the school. However, in the community, surrounding community of the schools, through the community development councils, when they were constructed, there is water point or wash facility in the community. There were trained caretakers. What we decided to link these from the surrounding community to support the school for this caretaker as the caretaker to train the support staff of the schools or some other staff in the school. But for the time being, there was not any person. Even in the beginning, in some of the schools, we found that beginning they got the training to take care of the wash facilities. But due to high turnover of the staff, especially the support staff, they have left for the time being, or during the assessment period, there was no trained person actively working in the school. The proportion of schools with trained teachers, that is in a better situation, means that at least 40% of the schools teachers got the training on wash package or components of wash package, and they were in these 40% schools they were active and they were conducting the training and convey the messages on wash to the students, and they had some hygiene promotion activities somehow on a regular basis in this 40%. The other 0% is about the schools with adequate storage ratio, which we could not find, unfortunately, even few percentage of the schools to have to meet this ratio. However, in the beginning there was, but as the schools told, for example, when the school is established as a primary school, the wash facilities, including the sanitation facilities and latrines, were based on this ratio. But here the problem in Afghanistan is that the people or the education department is just upgrading the schools. For example, from the primary schools, in the 2-3 years later they develop and upgrade it to secondary school and then to high school. But the wash facilities remain the same. So just in 1 year you can find schools with meeting this ratio. But 3 years later you see the same school that there are many students, but the number of classes is the same, and so it is 0. The other one is the percentage of schools with operation and maintenance budget. As I told, there was no wash facilities, including this operation and maintenance budget. There is no nothing is allocated for this. Or there is plan. There is the schools. This 40% the schools mentioned above had this operation and maintenance plan, but not allocated through the government or in a regular basis. The other one is the other indicator is percentage of schools with separate latrine for boys and girls. Found 10% of the schools, which are one of the schools out of these 10 that didn't have separate latrines. It was the school was running 2 shifts. In one shift, the latrine was used by the boys, and the shift the same latrine was for the girls. So the latrine were used by both of the sexes. Number of the percentage of schools with ministerial hygiene and health management facilities. There was at least 40% of the schools at the improved and well designed hygiene and ministerial hygiene and health management facilities, include like incinerator in some washrooms and some things like this. They add these facilities in some of them complete one. But even more than this 40%, some other schools they could make somehow, but it was not in an acceptable level. We didn't count it as a proper one. So the 40% of the school has this facility. Portion of the schools with standard toilets. It means that the standard toilets what the government is accepted, like mainly it is the 4-flush latrine and common in Afghanistan, and also the Ecosan latrine. This is based on the standards in Afghanistan that's accepted by the Ministry of Education. So we counted this type of latrines as the standard here. And 50% of these schools have these facilities. Number of schools with access to sustainable safe drinking water, it was like 90%, and however we are sure that it is very remote areas, this percentage will come down, but within these 10 schools it is like 90% of the schools have sustainable water, safe drinking water. Means the water source was inside the school, including borewells fitted with hand pumps and deep wells. The other indicator was percentage of schools hygiene promotion activity plan. As I told, in 50% of these schools, mean 5 out of 10 had the monthly activity plans for hygiene promotion activities, including using the IEC materials, and also talking to the students in classrooms and on the line in the beginning of each day. These type of activities were here and based somehow regular. on a written plan there. Percentage of schools with operation and management plan, it was also like 50% of them had the identified person written on the plan and on a sheet, existing office, identified person for looking after the hand washing facilities, the latrines, to keep clean and also to keep it functioning, and also the water points. 50% of the schools had this type of plan. And these are the indicators and our findings, and what we do. If we go to the next slide, we can see it is just shown on the graph, and this is 59, which 3 of the indicators didn't have any figure, and it is 0, so we cannot see this. And what we planned in the next plan, we have just identified that in the next plan, if we go, we identified the way forward to his bottleneck. The first was improve the legal and policy framework by creating a national wash in school policy, guidelines and standards, advocating for increasing budget. As we found in our case study, in our assessment, there was no specific budget, so we will advocate for that. Improve the database management system and keep it updated at least annually. Education departments at the provincial levels to have a database to manage this better, and to have the information if there is a weak point in the education department at the provincial levels. And especially there is no indicator of what very specifically in their database system. We will try to include that one. We have already started, and it will work. And we are hopeful, and by next month we will see the results. Maintenance budget, definitely, if there is allocated budget for wash facilities, it will cover the budget for maintenance of the wash facilities. Focusing on improving the quality of existing toilets, we just looking in there are lots of schools with very unsafe and sanitary latrines, pit latrines, and also single wall latrines, which is very serious, and we are taking those schools to update their latrines. There are some new buildings, however the buildings are new, can be very easily upgraded and convert the latrine to the safer types. I mean, mainly in the urban areas where the water is enough, the water sources inside the school, the pour flush is one of the proposed type of latrines for these schools. But for the rural areas where there is no water in the schools, especially if there is no water source available inside the school, then other type like EcoSan, which is the Ministry of Education, is implementing that. Standard practical strategy for involving the students and communities and private sector and operation and maintenance of the facilities, including fund contribution, will be also focused when we will work on that in our next to address most of these issues with involving the private sectors, which has been ignored till now. There is no contribution or participation of the private sector, and also through the parents and through the communities, we will work focusedly on these issues to support the education department and to support the schools at the school level and at the provincial level, the education department. Actually, these were the new points regarding our case study. as I told in the beginning, that we just try to say the steps and the whole information in the case study, which has been now we have finalized the case study. We can share with our colleagues Murat and Peter and our other colleagues Shadi and all of our colleagues on the site, and then our colleagues can read more and get more information about that. If there is any question, thank you very much. Thank you so much for your time. Very critical time. I took long time, I think. Sorry for that.
Thank you very much, Abdul. You have done a great work with putting together the study with the Afghanistan team. Thanks to the leadership of Ismail in pushing. And I know that you were working yesterday in your field office where there was no electricity and working with a laptop light kind of thing. So you have done a great work, and it's good to listen to you. As said, and I see the text back that people enjoy listening to your presentation. Great if we can follow the path that Afghanistan had taken. Please, summarize what you have presented on this presentation in text form and upload your case study at the Blackboard site. Get to Freeman, Shadi, myself, and Peter van Manen for seeking any input. And we have only 2 weeks left, so time is pressing. Share your case studies if you have your draft. Again, thanks to Afghanistan team for presenting, and well done, everyone. Thanks for reaching to this stage. It took lots of patience and persistence to attend these WebExes in difficult working conditions with pressing field visits and lots of work. So thanks for your commitment, and we have only 2 steps left. Good luck during next week with your exams, and more information will be at the Blackboard site, and your case studies, and look forward to reading. And it's great if you can read each other's case studies and then use the Blackboard site to comment on reading others' case studies. Again, thank you so much. Good night from New York, and look forward to connecting at the Blackboard site.
Thanks a lot. Thanks a lot. Thank you.
Thank you, Abdul Salam. Thanks to everyone. Good night from here.